this evening. Welcome to the COVID Conversation Clinic. We thank you for sharing your valuable time with us this evening as we discuss an important topic that continues to be a major factor in our lives. I am Randall C. Morgan Jr., and I am honored to serve as the president and the CEO of the W. Montague Cobb NMA Health Institute. The Cobb Institute is a 501c3 nonprofit research institute launched by the National Medical Association in 2004. The mission of the Cobb Institute is to identify unmet health care needs and develop solutions that will reduce racial and ethnic health disparities and improve the health of all United States residents. The Cobb Institute is honored to serve as one of the collaborating organizations this evening who have envisioned and produced this important webinar. We are led by the COVID-19 Prevention Network and BlackDoctor.org, who have hosted and promoted many informative webinars that present thought leaders and scientists who keep us current with the evolving knowledge about COVID-19 and the pandemic that we have encountered for the past 2 years. In this third episode of the COVID-19 Conversation Clinic, we will explore what normal looks like in the wake of the COVID-19 pandemic. We will delve into considerations for Black and other people of color as we resume activities and gatherings that the pandemic halted. We will envision what life will be, what adjustments we have to make, and how we can all work together as a people to get back to normal. We have a distinguished panel of speakers who will be introduced by our illustrious moderator, Dr. Doris Brown, President and CEO of Brown and Associates LLC, and also a past president of the National Medical Association. Thank you again for your attendance. Good evening, Dr. Brown.
Good evening, and thank you, Dr. Morgan, for that wonderful introduction. Yes, this is an exciting evening that we have for you, and we hope that you will enjoy this COVID Conversation Clinic. We're going to talk about what is the new normal for Black people and other people of color. And so let me introduce this illustrious panel of experts that we have. One, we have Dr. Candy Onami, who is the Senior Program Officer for the Bill and Melinda Gates Foundation in Seattle, Washington. We have Dr. Virginia Kane, who is the Director and Chief Medical Officer at the Marion Public Health Department in Indianapolis, Indiana. We have Dr. Cameron Webb, who is the Senior Policy Advisor for COVID-19 at the White House in the White House COVID-19 response team in Washington, D.C. And we're honored to have Major Serena Staples, a public health advisor and U.S. Army Nurse Corps, who is currently working at the Center for Disease Control and Prevention in Atlanta. We will start off with Dr. Candy Onami, who's going to give more about her background and speak a bit about the virus. Dr. Onami.
Hi, good evening and good afternoon. As introduced, my name is Tandy Onami. I'm a Senior Program Officer at the Bill and Melinda Gates Foundation, where we are supporting research around pandemic preparedness, COVID, and other diseases that disproportionately impact lower and middle income countries. I'm thrilled to be able to spend this evening and this afternoon with you talking a little bit around some of your questions around the virus, which is SARS-CoV-2, which causes the disease COVID, which we have all been impacted globally for the past 2+ years now. So I guess I will stop there and let the rest of the panel introduce themselves, and then I'll be happy to answer specific questions.
Dr. Kane. You're muted.
Now, can you hear me?
Yes.
Hi.
Thank
I'm
you.
also an associate professor of medicine in the Division of Infectious Diseases at Indiana University School of Medicine, and practice in our 5th largest public health hospital in the country, Ashkenazi Health. So, these are interesting times now that we're starting to see a newer surge with the latest mutant strain that is occurring in this country and 13 other countries, and predominantly in the Northeast corridor and the Midwest. And so it's going to be very interesting to see with the latest recommendations coming out of CDC in terms of who should receive a booster shot and a vaccine, how that may favorably protect the community greater.
Thank you, Dr. King. Dr. Webb.
Well, it's great to be with you all this evening. Again, I'm Cameron Webb. I'm an internal medicine doctor and lawyer by background, but had the privilege of serving as senior policy advisor for equity on the White House COVID-19 response team since last January. And I love the prompt for tonight's conversation, the new normal. And as an internist who's worked on the COVID unit at my hospital at the University of Virginia really since the beginning of the pandemic, I can tell you it's never going to feel normal to me that across our country we have, even now, 300 plus people dying each day. It's never going to feel normal to me that we've got over 1,600 people in the hospital right now across the country with COVID-19. But the new version of this COVID experience includes our having more tools than we've ever had before. And you've heard a lot about the vaccines being a critical tool, and we stand by that. Vaccines have absolutely saved lives. Some of the most recent data tells us that well over 1 million lives have been saved because of these vaccines. And it's actually over 2 million lives is the thought. That makes a huge difference. But there's other tools. There are other tools that are critically important too. The high quality masks that we've sent all around the country from the administration, over 400 million masks we've distributed. The COVID-19 test kits. Testing is a critical way of knowing where you stand and knowing that runny nose or stuffy nose could actually be something that's a threat to your family, your community, and others. And also now the new therapeutics that are available, like the oral pills like Paxlovid that can reduce the risk of hospitalization by 90%. The new normal for COVID-19 includes a lot more tools than we've ever had before. And for communities of color, that means making sure that they have the same level of access to those as anybody else. We can't let this moment pass by without absolutely advocating for it and demanding that our communities get everything that we need. So I'm excited about the conversation this evening, and thanks so much for inviting me to join.
Thank you so much. Major Staples.
Good afternoon and good evening, everyone. My name is Major Serena Staples, and I am a public health nurse, active duty public health nurse in the Army. And I'm currently stationed on an assignment with the CDC in Atlanta. I have, with the DOD or with the Army specifically, from the start of COVID-19 within the Department of Defense to working on the national COVID response with the CDC, I've kind of had a little taste of everything, and now it's trying to figure out, especially even in the military, how do we maintain our medical readiness and maintain mission critical or essential missions with our new normal of COVID, with vaccine mandates that I'm sure most people know about, and different public health plans that just need to be solidified before we get our soldiers out the door. So I'm very excited to be here and answer your questions.
Thank you all. So let's bring our panel back. And I think it's really important for us to start off with some of the statistical data in terms of the background. We've been in this nearly 3 years, and of course, there's over 80 million confirmed cases and nearly 1 million deaths from this disease. And I'm sure that many in our audience are really looking at the data. How does it apply to Black and brown people in this country? And so I'm going to call on public health people. So Dr. Kane and Major Staples, if you will respond to that. And then, of course, if Dr. Webb and Dr. Onami wants to jump in, please do so.
So one of the interesting things we saw with this epidemic, that it appears as though our people of color were way more vulnerable to contracting this infection. And when you looked at the Black community, they were 2.8 times more likely to be hospitalized compared to their white counterparts, and almost at least twice as many deaths. And very similar numbers that we saw with our Latino X population, with probably the Native Americans having the highest hospitalizations, much greater for their hospitalizations and deaths associated with this COVID-19. So one of the things that is a factor related to this, of course, is not always having a lack of access to primary care. So their ability to get in early when they're having symptoms, or even for someone to provide that community education for them to know when they may be experiencing problems. So poverty in the African American community is huge.
So would any of the other panelists like to add to that?
I think on the Army side, and I'm just going to speak Army, we didn't see, I mean, obviously we are fortunate to have the access to the healthcare. So it wasn't more of a poverty concern, especially when the vaccine came out and it was voluntary. It was more of a trust, establishing that trust in your healthcare providers and in the government. So I will say, and we saw that more in the minority community. So it was more of, having our nurses, our doctors, our public health professionals, our commanders, especially of color, leading by example to show that that they can have that trust within the government and with in our Army healthcare.
Okay, another question. We have heard about, I'm sure it's, for me, we have a whiplash about this mask. Put the mask on, take the mask off. There's a mandate here. So given the whiplash that we are experiencing, depending upon which geographical area we're in, is it really important to continue to have this mask? And I'm going to ask Dr. Webb, because you're seeing patients in the hospital and you're looking at cases that may be coming in. Can you sort of address, and also because of the federal mandate that is now in the courts, because we're being tested by some state to say we don't have to address this mask. Can you speak about the mask for the country, but also for people of color in particular?
Absolutely. So I'm going to start with kind of the official answer, if you will. So,
Yes.
I'll start there. The official answer on masks is this. If you go to covid.gov, you can, at the top of that website, you can actually enter the county where you live, and it'll pull up CDC's COVID community levels. And that'll tell you what the risk level looks like within your county. And in that county, it'll tell you whether masks are necessary, if you need to wear masks because there are higher levels of hospitalizations, if they're recommended, or if you don't need masks necessarily in that community. Keeping in mind, there's always some individuals in the community who probably will need to wear masks because of different dynamics that make them more susceptible to illness with COVID-19. So that's the first place where you look for guidance on masks, and CDC updates that every Thursday. And so you can get a sense of what it's going to look like for you the week ahead for wearing masks. The other part of it is, as you mentioned, the masks with public transportation piece. And that's what kind of was shaken up last week when there was a decision by a Florida district court judge suggesting that CDC didn't have the authority to implement a mask requirement in these transportation spaces. Understanding CDC's authority to really make public health measures and put those in place, particularly when it involves interstate travel. That's been long established. We as an administration feel pretty confident that this can be overturned on appeal. That's the reason the Department of Justice appealed it. But just the same, that district court decision has gotten rid of that mask requirement in public transportation spaces. We are telling everybody, continue to follow the CDC's guidance on this rather than that district court judge, right? If you want to get a public health opinion, you would get that from the public health experts, not from a judge down in Florida. Now, that's the official answer. At the end of the day, you may be done with COVID, but COVID is not done with us yet. And that's what I tell people all the time. It's so important to use all the tools that are available to us to stay safe. Actually, shortly before this call, I went to the grocery store and I still put on a mask when I go into the grocery store, even though in my community, the rates are lower. And the reason is that I have family members who are immunocompromised. The reason is that in my community, more people have a burden of chronic diseases that puts them at greater risk for severe COVID-19. And so part of my reason for wearing a mask is it doesn't bother me to continue to wear a mask when I'm in public spaces, but B, it's important for me to keep other people safe. That's one of the things that I think we've been disproportionately harmed as a Black community by this pandemic. And so it stands to reason that taking extra precaution is in order where it is possible. That's kind of my recommendation to folks. If it's possible for you to still wear masks in different places, by all means do. That doesn't mean you can't, if the COVID levels are lower in your community, you can't go dine indoors without a mask, or you can't go to an event. You can, but keep in mind, those are all multiple opportunities for you to end up getting infected with COVID-19. And every day, thousands of people continue to be infected. So just take an honest inventory of that potential risk. But at the end of the day, CDC has its formal guidance. I say in our community, we use a little bit more caution than that.
Thank you so much. Now, Dr. Onami, given that we are seeing almost a whiplash of this virus, that we started off with the alpha, beta, delta was really one that we were seeing in the hospital a lot. And now we have Omicron. Now we have Omicron and B2 and then a subvariant of that. Can you speak a bit about the virus and how we end up with variants as it goes on?
Sure. Yes. So first of all, it's important to recognize. I really liked what Dr. Webb said about the virus. We may be done with the virus, but the virus is not done with us. The virus does not care about your political persuasion. It doesn't matter. It has little care for what you choose to do and not do. What we do know is that it's a respiratory virus. It mutates very rapidly, and it spreads primarily among people. To give you a sense of globally, there are 500 million confirmed global cases. And if you consider that there are many, many, many more cases than that were never confirmed, you get a sense of just the sheer number of individuals that this virus has infected and multiplied. And each time it multiplies, it changes a little bit. It's like a telephone conversation. If everybody passes a message on, by the time it goes quite a bit further, it's changed. It may keep the same basic outlines, but it can change quite a bit. And so that's what has happened with the virus as it has continued to multiply in people. as well as some animal species, it has continued to change. And as it has changed, those variants that are most capable have had some advantage, and they have therefore proliferated or become more common in the population. So the current variant, which is the Omicron, is what is called a variant of concern. And Omicron spread mostly from its identification in late November in Southern Africa and Botswana, Hong Kong, and South Africa. It spread globally, and then as that variant spread, it had a little bit of a change, and that's the BA2 variant, which has a little bit of a change in a key protein called the S protein. And this BA2 variant is actually even more infectious than Omicron. So it's basically a cousin of Omicron. It's not different enough for it to be renamed, but it is a version of Omicron, just that is highly infectious. And so that is the one that is spreading right now. And of course, because in the US, we just recently went through a huge wave of Omicron, particularly in January, we're kind of on that downslope. And so this newer variant is spreading, but it is capable of reinfecting people who were previously infected with its cousin, if you will, the Omicron version, which is called BA1. But it is, that's rare right now, mostly because of just everyone's immunity, either because they got a booster shot or because they were infected. There are fewer people who are being duly infected with Omicron 1 and Omicron 2, for lack of a better distinguishing term. So I agree completely with Dr. Webb. Whenever I go into public spaces, I wear a mask. The vaccine has been extremely effective of keeping people from having severe disease, but it was not designed for keeping people from completely being uninfected, and that has stayed the course. And so you got to use whatever tools you have. You know, you if you're in a car, you don't just say I have brakes, so I'm going to stop. You wear your seatbelt. You do other things to make sure you stay safe. And so for me and my family, when we go into public spaces like supermarkets and those types of places, we wear a mask. I have no shame in putting on a mask. And so I encourage people to do the same, but certainly recognize that not everyone can wear a mask every day for various reasons. And so being a little bit I think, generous with our support for people and what they can and cannot do is important as we get through this pandemic.
I think one of the things to really mention also about this mask, I was in church this past Sunday, and one of the persons that was sitting next to me was wearing a cloth mask. And so we have to really emphasize and focus on that the cloth masks now are not as effective starting out because this virus has changed, it's mutated, it's gotten smarter. And so we now need to strongly recommend people get a mask that's called a KN95 mask or an N95 mask or surgical mask, which are more protective against these newer strains than the cloth masks. Now, I have to say that the person next to me, the cloth mask was gorgeous, matched her outfit and everything. But I thought that it was so important that, we need to start recognizing and keeping up to date with the latest evidence about the effectiveness of masks. And so just really want to encourage us getting the appropriate mask to wear when we're out there in the public.
And
Dr. King, if I could piggyback really quickly, because I think it's important to talk about masks. A really important thing is that masks aren't comfortable if you have the wrong mask. And a lot of people think they're focused on masks, how it fits around your face. If you can't tell from the screen, my ears stick out a little bit. And the way that works is that those KN95 masks that loop around my ears drive me nuts. It ends up really uncomfortable for me. So I got this mask. It's an N95 mask, but instead of looping around my ears, I put it on under my chin, and it wraps around my head like this. So I've been able to find a mask that works better for me, that keeps me protected, and it was just a matter of finding the right mask, right? So that's one thing that you want to know. The other thing, there are much more comfortable masks today than there were much earlier on. One of my favorite is the 3M Echo, is what it's called, 3M Echo. It's really soft. It's got kind of some padding around the nose. The band is really comfortable. So I don't have any stock in 3M, so don't think I'm trying to sell you anything. But the main thing is that it's trial and error. I had to find the right high quality mask that I could wear for long periods of time. And I was able to do that. And so I encourage you to do the same. Know what mask works well for you and definitely take advantage of that.
And just to add to those comments, it's important to wear the mask correctly. To wear it where your nose is exposed is not having the mask on correctly. You want to cover your nose and mouth. And yes, you want to have the mask as comfortable as possible. So there was a question, I believe, about how do variants get created? And I think, and because this is like the kitchen cabinet clinic where we're having a conversation, let's move to first name. So Candy, we talked about the variant, and as long as it's around, the whole idea of the virus to stay alive is it has to mutate. It changes because it wants to live. And so that's why we're going through the various Greek alphabets, as someone has said. Are we going to get through all of the Greek alphabets? Well, if we don't get vaccinated and boosted and come up with a higher percentage of people that have been covered by the treatments that we have available, we may get through other variants. Does anyone want to comment on the variants?
So I'm happy to kind of start off and let other people jump in. So as we said, the virus replicates, and each time it replicates, there's an opportunity to make changes. And so most of the changes will have no effect. Some changes will be negative, and some changes will be positive for the virus. And so the things that we pay attention to as scientists are when you have when something happens in the course of those changes that you see what are called variants of interest. So variants of interest say, okay, well, this part of the virus has changed a bit. Is this something that we need to be concerned about? Because that change is something that can make the virus more harmful in some way. And that harm could be because it spreads faster. That harm could be because it causes more severe illness. There are different ways in which you can classify that. And that classification is done by global experts on a panel, and they review the data that's being shared from all over the world. And then once they label it a variant of concern, then that pretty much triggers a public health response, which I'm sure Major Staples can discuss. But the key is that this is part of any pathogen life cycle. When pathogens replicate, they are able to make changes, and those mutations can be beneficial, deleterious, or just not have any impact. So that's the I think, the shortest answer. And just to quickly say, we hope we don't go through the whole Greek alphabet, but there's no way to know today, just like there was no way to know in December of 2019, what this was really going to turn into. So we just have to do our best to protect ourselves, get vaccinated, those of us who can, because that limits the ability for the virus to replicate. And I do want to add one other thing is that for people who are immunocompromised, and you can become immunocompromised for various reasons. You could have an illness like cancer, or have born with a illness that keeps you immunocompromised, or you can have acquired immunodeficiencies, such as people who have HIV/AIDS. And so what happens is that when the virus replicates in people who are immunocompromised, it actually can potentially replicate more and therefore introduce more changes, because there's very little ability to clamp down on that replication. And so it actually is a concern, because you don't want our most vulnerable community members to be at highest risk, and that can happen with the exposure that they get when the community is not well vaccinated. So,
Major Staples, were you going to add something to that?
I don't think I have anything to add. I agree completely.
Okay.
I think one of the things is that, viruses, they're sort of like, they aren't living things in a sense, and they require a host in order to replicate. So they, once they learn how to attach,
hijack.
Yes, that's exactly right. Mm-hmm. They're hijacking our host body cells, and then they get in there and they co-opt our what do you want to call it, a factory or plant, how we reproduce cells. They take it over and are able to make large numbers, produce large number of viruses. And I think sometimes, they're doing this genetic copying or whatever, and they can have an error that can occur, or a change can occur based on that person's individual immune system and what kind of protective, whether they have antibodies or other special cells, makes a difference in terms of the changes that take place with these viruses. And like, take influenza. Influenza viruses changes more rapidly. So that's why we end up getting a new flu shot that's different every year. And some viruses, they change and mutate much more slowly. And so, but this COVID has been pretty rapid, mutated changes that take place with these new variants.
Okay, there are several questions in the chat box. One, is the government still giving out high quality masks, since we were talking about masks? Who would like to take that on?
Yeah, I can. So if you go to, and you'll hear me say this website probably on most answers, if you go to covid.gov, masks are one of the 4 tools that we've kind of listed there. So masks, vaccines, tests, and then therapies. Those are the 4 tools that are listed there on covid.gov. You can click the link, and then you can enter your zip code. It'll tell you what pharmacies or grocery stores or whatever it may be in your community that we sent those high quality masks to. So we certainly sent them to a lot of communities. I think the next step and the challenge is that we don't have a way of keeping track of exactly how many masks they have left, but we did send them to every community. And so just put in your zip code and it'll tell you where those are available in your community. So again, covid.gov is the place to look.
Okay, I have a question about tests, and then I want to go back to talk about boosters. If most people are being advised, are most people being advised to report their positive test results if they receive the test kit?
So I think it depends on what state you reside in or what city that you live in terms of whether they report their tests. And people are concerned that maybe our positivity rate is low, our cases are low because people are doing these home kits and they're not reporting it. But I want to remind people that when we had the PCR test, there was at least in the state of Indiana, we did what's called a prevalence test that told us about 40% of the people in Indiana had no symptoms whatsoever, so they didn't even go to get a test. And so now with these home kits, you will find if somebody's sick enough, they're going to have to go to a urgent care or emergency room or their doctor, and they'll probably get another test that may confirm their cases. So we have another sort of like a formula we kind of use that kind of lets us estimate based on the number of people coming to the emergency rooms, the emergency room visits, based on the number of people who are being hospitalized. And remember, back in December, January with the Omicron variant, wow, we were seeing, like, at least in Indianapolis, we were seeing over 3,000 new cases a day. So in our ERs and our critical care beds and everything was just overwhelmed. So now we've seen a dramatic 2-month drop in all of those cases we saw across the country because we were doing a better job getting people immunized for protection. I think we're doing a better job of people wearing masks appropriately and having a community-wide um, cooperation, collaboration, whether with businesses, faith-based churches, school systems. It really made a huge difference, I believe.
Well, and just to add really quickly, yeah, I'm looking at our board that we have from the White House every day in terms of COVID numbers, and it's telling me that the most recent day we have on record, which would be yesterday, so it was 15,249 cases of COVID-19 across the country, and that number's wrong. We know that there's no way for that to capture all the cases because we know so many more people are doing at-home testing, and people often ask me, well, if we don't know how many COVID cases there are, is that bad? Are we losing sight of the pandemic? I think what we've been able to track are a few things. In addition to these cases numbers, these are PCR tests that we're recording, not at-home rapid tests, but and so that's laboratory-based tests. But in addition to those numbers, we're tracking wastewater testing, which is one of the ways that we keep a sense of, more broadly of how much COVID is out there. We're tracking symptom surveys, which are being executed all over the country at all times. So we're looking at that nationally. We're tracking Google search trends, people searching for different COVID symptoms, which gives us a feel. We're really employing a lot of public health tools to get a sense of what's the burden of folks with COVID at any given time. But then what CDC's done is they've shifted to looking at hospitalizations as kind of our measure that we want to track, because that gives us a sense of our resources. What's the current burden of COVID going to have on the resources we have to fight back? The hospitalizations, the hospital beds, the ventilators, those tools that are necessary. And that tells us when we need to do something different from a public health standpoint. So while cases are still really important, it's not the only number that we're going to be tracking. And also, I think more broadly, because of the new normal, because of the way that people are navigating now, people aren't necessarily, posting all over the social media that they have COVID these days. They do their 5 days of isolation, of strict isolation at home. They continue to strictly wear a mask for the subsequent 5 days after that. If they have the privilege of being able to work from home, oftentimes they're able to do that. If they're vaccinated and boosted, they may have a really mild case of COVID. So there are a lot of differences now than what we had earlier in the pandemic. But just want everybody to know, we are still tracking very closely the trends and what we're seeing.
Yes. And since you brought up the boosting and when you should get it, there is a question in the chat. Who and when should people get the second booster? And in particular, if they recently tested positive and have passed the 5-day isolation?
So I know that CDC came out recently stating that the individuals who should get the second booster are individuals who are 50 years and older, and those individuals who are any individuals over the age of 12 who are moderately and severely immunocompromised.
Okay.
So is who they're recommending for the additional boosters, I believe.
Yes.
And just, sorry.
Go ahead, Major.
And just to add to that, the CDC did put out a little blurb about, can I wait for the second booster? And they did put out information saying that, yes, if you've had COVID within the past 3 months, yes, you can wait. If you feel like getting the second booster now would make you not want to get a second another booster in the future, such as fall 2022, then yes, you can wait. So along the guidelines of the 50 years and older, they do have a section of recommendations on if you want to wait for the second booster. But the thing to answer your question, if you pass the 5-day isolation, the CDC says yes, you can get your second booster if you do not want to wait.
Yes. And for those people that are thinking that, well, why am I needing to get a booster? I've had the vaccine. Does it mean that the vaccines are not effective? The boosters are not effective? I've gotten one and now you're telling me to get a second one. So just to clarify in the minds of our community, the vaccine was not 100%. It was to keep you out of the hospital and prevent death. And I think it certainly did that. You then have to look at the immunity, but I'm going to let my guests speak on that and why we're at the point of getting a second booster. And we have the data in terms of what CDC is recommending for those that should get the second booster. And then I want to go to some treatments. Okay.
Sure. So I'm happy to jump on that. So as people know, when you get sick, that sickness resolves, and then you can have immunity that comes from that sickness. When you take a vaccine, you similarly are getting some aspect of that pathogen that can help you, instead of going through being very sick and surviving, you take something that's much safer, but also generates the same type of immunity. And what we know is that immunity, particularly the antibody response, wanes over time. And so based on that waning and looking at people who've become sick or reinfected with these variants, as we say, we can tell that people who were more recently vaccinated had lower risk of getting the more severe illness. So that's where kind of this boosting regimen comes. So basically about 4 to 6 months after your vaccine series, if people were boosted, their chances of getting severe illness was quite low. So, for example, in this last Omicron wave, those people who had recently boosted had a 90% chance of not being hospitalized or having being severely ill, needing mechanical ventilation, for example, versus people who had only received the primary series, it being more like 80%. And so you essentially boost your chances of not having to be severely ill as a consequence of becoming infected. So that's the idea. And as was noted earlier, it was thought early on that coronavirus, like influenza virus, could potentially be something where you might have to get yearly boosters. That may turn out to be needed. It's still early days. I want to remind people that before 2019, nobody knew about this virus. So it's very much a new pathogen in that we are experiencing among people globally. And so we're learning as we go. And so the booster is the best way to protect yourself from severe illness. And you should, 4 to 6 months, especially for those who are 50 and older, and for those who have other things that make them particularly at higher risk for becoming severely ill with COVID.
Okay, there is another very interesting question in the chat box. The individual has a brother who has had COVID and recovered, fortunately. He is refusing to be vaccinated. He does not wear a mask consistently. She is an organ transplant recipient, and her parents are over the age of 70. She is asking, what can she do to protect herself and to really protect the family members, as well as continue to try to encourage that brother to wear a mask more consistently, most importantly, to get vaccinated. Comments?
Well, I think it's important to know how long ago did he have his diagnosis of COVID. So technically, a lot of people say that once you have a COVID diagnosis, you have a natural immunity for up to 3 months, 90 days. After that, they revert and have a much lower antibody where they don't provide protection against getting a recurrent infection. And you have to understand, someone who is a organ transplant, that is a person who is moderately to severely immunocompromised. So when they contract COVID-19, the chances are extremely high that they can become hospitalized and also develop complications where they get intubated. But that drops dramatically if they have received at least what we call 3 primary series of the vaccine, and then the additional third and fourth. They may have a third and fourth booster for the organ transplant. So that's what the new recommendations are telling you. If you're over the age of 50, or if you're mildly or severely immunocompromised, consider getting the additional booster. Now, you have to understand, we're not over this pandemic yet, and we may be. Hey, there's a possibility we could be 6 months to a year from this. And do you want to unnecessarily put your family members at risk? So it would be nice if they're interacting with him, that they're doing it by Zoom or whatever you do, where you can see them by these kind of applications where you're not there in person. But if they still feel they have to interact in person with this relative, then everybody should be wearing a N95 mask. But hopefully you meet at another location, because you don't want them inside your home and they've now spread these respiratory droplets in your home, because once they're gone, those infected respiratory droplets may still remain in your home a certain period of time. And so even though you're wearing a mask while he's there, you'd like for him to at least wear a mask if he's coming into your home. But if he's refusing to do that, then meet him at another setting where you're wearing a mask, but he's not bringing infected droplets inside your household.
Yeah, and I mean, let's get down to brass tacks, right? Because in real life, there's how people move. We can give you the best, most sound public health guidance that's rooted in the 100% best way for you to stay safe, and that's going to be important and valuable. I know that in my family, with certain relatives, that best advice, it's going to be really hard to get people to adhere to that. So when you're on an airplane, what people tell you is if there's a sudden change in cabin pressure, put on your mask first before helping somebody else with theirs. What I would tell you, if you're immunocompromised, in addition to the things Dr. Kane mentioned, I would strongly suggest that you talk to your healthcare providers about Evusheld, which is a preventive monoclonal antibody. Essentially, you would take essentially 2 doses of this every couple of months, and what it does is it gives you extra antibodies because your immune system may not mount the same response to the vaccines if you are moderately to severely immunocompromised. So that's one additional tool that we have that's available for you. Again, it's Evusheld, Evusheld. It's widely available. Talk to your doctors about whether or not that's something you should consider taking, because I think it's another way to keep yourself safe. And then, I think making sure that you're also, in addition to employing masks around that individual, make sure you have tests available, because one thing that we know is that if you have tests available to you, you can get tests by going to covidtests.gov. We send 8 tests out to every household. But in addition to that, if you've got health insurance, you're entitled to 8 free tests per month that your insurance pays for. And that's for every covered individual in your family. So make sure you've got a stockpile of COVID tests. If somebody's going to come over to your house, hand them some COVID tests. If they don't take it on their way, make sure that they take a COVID test before you interact with them, even if you have your mask on, because that's another way that you can keep yourself safe. I think the more layers of mitigation you have between you and potentially getting sick, and that applies to your parents as well, the better. And so definitely take advantage of the use of masks, of testing for folks who are going to come in contact with you, and then of things like Evusheld for immunocompromised patients that are going to be helpful in addition to vaccines.
Yeah, and I would just add one thing is having the conversation as to why he does not wish to be vaccinated. He had his episode of COVID in September, and the likelihood of having some natural immunity, as Dr. Kane has indicated. But over time, that immunity tends to wane. And so again, really, it's difficult to understand people that don't want to get vaccinated, but you have to kind of have that honest conversation with them. Is it a fear of something? Yes, perhaps he had a case of the COVID that was mild and didn't end up in the hospital on ventilators, etc. It may not be the same in the next
Well,
iteration.
I want us to not forget about the fact of the long haulers related to COVID. And that is a significant risk that can occur, where you can develop chronic fatigue syndrome, or you can have issues such as brain fog. It's a possibility that you can involve different organs of your body, so that you might all of a sudden have problems with heart palpitations all the time. And you can even have some long-lasting damage to your lungs, where you never had a problem with shortness of breath, and now you're short of breath just walking maybe 2 blocks that you didn't have before. So about 18 to 20% of folks can develop these long-term symptoms. And if you're young, you say, wow, I'm having all these joint pains all of a sudden now, like I got arthritis and I'm young. I can't believe this. Or I may get hair loss. So you run a risk when you get infection sometimes that we have to be very cognizant of, that can have long-term complications.
Yes, and it's good to talk about long COVID because it is real. Let me ask another question in reference to pregnant women, and whether pregnant women, there's been some controversy about they should not get vaccinated, and many women, particularly women in southern states, that believe that it might harm their child. Can we speak about the vaccine and pregnancy and the safety thereof?
I can start. There's a tremendous amount of data that the vaccines are safe in pregnancy. These are really well-designed studies that looked at folks who were vaccinated at different points in pregnancy, and you don't see any increase in the risk of negative outcomes of pregnancy in folks who are vaccinated. And as time has gone on, we've seen more and more people who've been vaccinated and had really successful pregnancies. But I'll tell you, there is a significant risk with regard to this pandemic with pregnancy. It's not the vaccines, it's COVID itself. I've admitted more pregnant women or pregnant people to my hospital for COVID-19 than for any reason over the prior 10 years. COVID-19 is incredibly damaging to mother and baby. And so I think it's so important for people to keep in mind that the real risk here is the virus itself, the harm that it can cause, the bad outcomes we've seen with pregnancies due to COVID. And vaccines are one way to protect yourself. And it does have some benefit also. After the baby is born, there's some, immunological benefit to the newborn of having a mother who's vaccinated. So these are all things that help, but I think that the data has become really clear. That is rooted in deep misinformation. We've worked really hard to undo that, and we've seen the rates of pregnant people being vaccinated really climb in recent months. So I think people are kind of getting that memo that it's safe and it's effective.
I think the really key point is that pregnant mothers who get COVID, they have higher complications than just an individual same age who is non-pregnant, and it can impact their baby negatively. So it is so critical to get vaccinated in order to protect the mother as well as the baby.
Thank you.
And the one last thing I'll say again around safety, that, it's important to recognize that over 11 billion vaccine doses have been given globally at this point in time. And so we know a lot more about these vaccines than we did 2 years ago. And so people should really feel confident that that these vaccines are safe, and being able to protect themselves so that they're there for their babies and protect their babies as much as possible is, something that they should really put at the front of mind.
And she said 11 billion. Now, those are doses in the country.
Yes.
We've used 569 million doses in the United States. 569 million doses. That is unheard of. But I do want to emphasize, because I think it's so important, we've had some talented young researchers. We don't want to forget Dr. Corbett, who helped to develop the Moderna vaccine while she was at NIH and now at Harvard. And we've got people of color who are contributing significantly on the treatment arm. And so I'm just so impressed with what we are doing and how rapidly we've been able to provide resources in this country. And I know President Biden just talked about the new oral medications we have now you can take preventatively. He's going to put out, 20 million more doses out there related to this drug to our pharmacies and places, so that we can have access to these newer treatments now to take care of patients who have a COVID infection. So you don't have to get so sick that you need to require hospitalization, or you don't have to go to a hospital to get a IV intravenous infusion all the time. So some wonderful, remarkable discoveries that's going to help us with other diseases, such as HIV, such as different cancers. So I'm just excited where the discovery in science is going to make so many advances for our health. So
Yeah, it's very wonderful that we have made many advances. And while we talk about vaccines and boosters, there is treatment, and as Dr. Kane has indicated. So if we want to speak about treatment right now, because I have another misinformation fact that I want to have you address in just a moment. Any other comments about other treatments? Because we have the oral treatment as well as IV and the monoclonal antibodies as well. So other comments? Go ahead, Dr.
If we're going to talk treatments, I think there are some data points that are really important for folks to know. And the first is that you've got there's a clock on these treatments, right? Yes. From the moment that you start to have symptoms, you've got 5 days to get this treatment. And in those 5 days, you got about 6 things that you need to do. You need to first recognize, I've got COVID symptoms. Second, you need to go get a COVID test. Third, you need to get the results of that COVID test. Fourth, you need to contact somebody who can prescribe you medication. Fifth, they have to prescribe the medication. Sixth, you got to pick it up. That's a lot of things to do in 5 days, especially if you're not feeling well. Now, these treatments, Paxlovid in particular, is what it's called. It's for folks with mild to moderate symptoms, but who are at high risk for severe disease. That includes folks with diabetes, with heart disease, folks with asthma or COPD, and folks who are obese, right? There's a wide range of conditions that fit into this category. We estimate about 60% of adults who have COVID-19 may be eligible for this medication, Paxlovid. So again, 5 days from the start of your symptom to get that filled. You can go to covid.gov, there's that website again, and you can actually search for these test to treat locations that actually put all that in one location, right? You can go get your COVID test and the result and talk to a prescriber, and if appropriate, get the medicine all in one visit at one time. That's one thing that the administration is doing. We got over 2,200 of those sites already online. Today we announced we're going to put a lot more of those out there. Some are at federally qualified health centers, community health centers. Others are in the VA. And then there are a lot that are pharmacy-based sites like CVS's Minute Clinics and the like. So lots of ways to get folks access to these medications. But just want people to keep in mind, if you have symptoms, don't write them off, right? Go ahead and get a COVID test, because there is a clock that starts ticking not the moment you get a positive test, but when you start to have symptoms. 5 days from there to take this medicine, if you take it, can reduce your risk of hospitalization or death by 90%. That's 90%. That's a big deal. So don't miss that opportunity to take these medications. We really think they're a game changer.
Yes, and I think that is part of the administration's, what is called, Test to Treat program. Is that what it's called?
Absolutely right. Yeah, test to treat.
Yes, that's a very
And they're
important.
supposed to double all of their sites definitely within a month. So I'm just telling you what I heard, Cameron. Okay.
You nailed it. I might as well put you on the payroll. We have over 20,000 pharmacy sites so far. We're going to increase that by at least 10,000 in the next couple of weeks. And our aim is to get that above 40,000 pharmacies that are carrying this medication. And then in addition to that, really increasing the number of test to treat sites. So we're trying to get as many avenues as possible for people to have access to these medications. In addition to, there are 75% of folks who have a usual source of care. So in addition, we're working with their healthcare providers to make sure those prescribers know where they can get their patients connected to Paxlovid and are prescribing that appropriately. So lots of different ways we're working now.
Yes. Major Staples, I'm sure that since the VA has the a program there, I would certainly make the assumption that the military also has it in the military treatment facilities as well.
Yes. Our population on the military side, at least the Army side, is very young. So a lot of them will not fit into that criteria so much, but we do have a very large beneficiary population, a retiree population that does get serviced by the VA, but they also get service on post as well. So yes, that is an option. I'm definitely an advocate for it because, you don't know, you could have mild symptoms or you could be hospitalized. You just don't know. And so I'm definitely an advocate. I agree with Dr. Webb.
Well, I'm a retired military and I get my care at the military facility. Got my vaccine and yes, really support it. Let's talk. The myth or the misinformation is that getting this vaccine will alter my DNA. I know we've all heard this many times. So can we clarify this so that perhaps people will walk away and never say this again?
So definitely that is not the case. The viruses or even the vaccines that are sort of man-made products that come in to help induce your host cell to develop antibodies. If you know the anatomy of our host cells, we have something called a nucleus, sort of like the brains of our cell, and tells our operations what to do. And then we have like our what's called the cytoplasm part that is outside of that DNA or nucleus brains of your host cells. And these antibodies that are produced are even the instructions to make and induce antibodies. They never are able to penetrate or get into the main brain part of our host cells. Never. And so if you can't do that, there's no way we will be able with these vaccines to alter our genetic makeup of our cells. And maybe, I don't know, Dr. Tandy or
Yeah.
Serena or Cameron, you may have even a better explanation than that.
Right. Yeah. So that's absolutely correct. The vaccines that are available in the United States are mRNA vaccines. They're one step before protein vaccinations. So you can have a vaccine that's normally a bit of a protein that comes from a pathogen. And by training on that bit of a protein, your immune response is able to recognize that bit of a protein. And what these vaccines that are available from Pfizer and Moderna do is they have the earlier step that instructs your machinery of your cell to make a small protein bit. So it's like, having a little bit of a earlier production. So instead of somebody making those proteins somewhere else, it's helping your body to make that little bit of protein. And then once you make that protein, your immune response is trained on that protein, just as we said before, and that is how you develop immunity. I think at the end of the day that it's important for people to have trusted people in their lives who they can learn and discuss things. I think it's, if there's a lot of distrust that's well earned in the African American community because of some of the history of medical care and research in the United States and abroad. So I think that, how I've looked at it for my family members and my friends who have had resistance is just continuing to talk with them and know that I remain a trusted resource for them. And I think that that's what we should all do as friends and family members to help make sure that those people we care about can take care of themselves by getting vaccinated.
I know that's the right answer. I know that. I think Ellis is trying to wrap us up.
No. I was just going to say, Dr. Tandy, that was a great response. But I need that response for the people like me that sat in the back of the classroom, that may have been playing around, not really paying attention to biology class, not doing what they're supposed to be doing in chemistry and math and science. I need you to explain that for us.
That's what I was about to get to.
So guys, in the center of all of our body cells, in the center of our cells, we have something called the nucleus.
Okay.
This is where our DNA. This is where our DNA is held. Okay, all right. Cameron's got it.
You are right. You are right. But at the end of the day, we are not going to teach everybody in America to understand the whole of science. We're not going to talk about cytokines. We're not going to talk about mitochondria. People don't need to know that. At the end of the day, there are some people who ask that question, have been asking it for a year and some change, and that is their way of saying, I don't want to get this vaccine. Woulda, coulda, shoulda, it might do this and that. And I think, Dr. Tandy, you're right. That's the correct answer, but I'm tired. And I know a lot of other people are tired too. Mm-hmm. And so I'm going to tell you like this. All the people who went to medical school got vaccinated. 90% of doctors got vaccinated. We're the ones who spent years studying mitochondria and DNA and RNA and proteins and cells and viruses and vaccines and how they work. We are all getting vaccinated. There's a reason for that. Not only that, we're getting our children vaccinated. My 6-year-old and 10-year-old, people I love more than anybody in this world, vaccinated. People who made the vaccine, who know all the science about it, vaccinated, right? And so at the end of the day, people always say, don't tell me, show me. The truth of the matter is the people who have the most scientific knowledge about these vaccines are vaccinated, right? And it's not because we're not risk averse. You may say, oh, we're throwing caution to the wind. We don't care about what happens. You can't say that about a population as large as the health professional population, right? We're as large and diverse as any segment of the population. So at the end of the day, I think a lot of times the people who continue to make that argument at this point, after we have had Yeah, 219 million people vaccinated. People who continue to make that argument are just using it as a cover for the reality that they don't want to get vaccinated. We have to say, listen, we know where the science is. We know it's safe. We know it's effective. We know it saves lives. We also know that there are thousands of people who have died because they did not get vaccinated since June of 2021 when vaccines became widely available. Thousands of people dead because they didn't get vaccinated. And so I think that, yes, we do have to continue to exercise that patience. We have to continue to lean in and answer people's questions. But I'm going to say ones like that, asked and answered, right? The facts are there, and people need to just pay attention and do things in their best interest. If you're not going to, you need to wear a mask. You need to do something from a mitigation standpoint to keep our community safe. I'm sorry. Y'all got me.
Okay, Alex, can I say my last point? Okay. So people always say, oh, I don't know what's in these vaccines. You know, I'm not sure it's safe. I got to wait for a while and figure that out. But you know what? I can't tell you how many people I may go to a place that's got entertainment or whatever, and they may offer some wine or a new drink, and I never see anybody question what's in the contents of that drink they're being offered, or a new wine bottle, what's being offered. And they don't have a clue what's in there whatsoever. But when it comes to the vaccine, it's like a totally different story. So,
but I think the bottom line is we have been getting vaccines since we were born.
Right.
We have never had the controversy around vaccines that we have over this new virus. Well, let's get over it, people. It's because it has moved out of the healthcare arena and moved into the political arena. Clap it up. It doesn't apply to us. Get yourself a vaccine, get boosted, stay alive. Talk to those people that you trust. And those people are, I'm not sure who was in that trial. You take medicines every day and you never ask any physician, tell me who was in the study that got this drug to market. Did they look like me? No one has ever asked that as a patient that I have seen, or that any of the other healthcare providers that are here now have had that question.
And
You
fully
have to have a
So let me just make two quick comments. I think it's important for us to recognize that, number one, a lot of people don't know and have friends that are doctors or scientists in this world. So first we need to say, so who you're getting your information from does matter. So someone saying that those people do that doesn't mean that I need to do that. So I think that's really important. And the trust thing is important. Although it's true that not everybody says, I don't want to drink that, I don't know. I know a lot of friends and family members who don't take medication, which they should take for whatever reason, because they don't trust it. I remember my grandfather, ibuprofen, wouldn't take it. Okay, so we do need to recognize that trusting in medical products, whatever those things are, vaccines, drugs, it relies on trust. And so because we recognize that we're coming from a space where trust has been broken,
right,
over and over again, we don't get to be able to say every time that you just need to trust me and that's it, because it's been broken so many times.
Right.
That's
for us, I would say, let's get down to brass tacks, right? Where does, like my old preacher used to say in college, where does the rubber meet the road? So what do people need to do if you are still unvaccinated, and in these times where mandates are being lifted, we've got all this kind of, people they're shifting back to normal life, whatever that is. And that's what this whole conversation was about. What is the new normal? What can people do today to keep themselves and their family safe in this new normal? So Dr. Webb, you've done a great job in terms of saying, hey, COVID.gov, there's a host of resources there available to you that you can go check, to go get tests, to find those testing centers, to find out what's going on. So what can people do in a general sense, us lay people, what can we do to keep ourselves and our family safe in this new normal?
checklist of 4 things. And first, I want to thank Dr. Thandi for that point, because you're absolutely right. I do want to acknowledge, there's a trust dynamic that we always have to look back into and lean back into. That's a very real dynamic, especially when you think about the medical apartheid that our people have faced across the centuries since the first enslaved Africans arrived here. But at the end of the day, it's our responsibility, those of us who have the insight, have the awareness, have the ability to share this with trusted people on the ground. It's our responsibility to make sure we're doing everything we can to educate our people and to make sure they know what's true and what's not, because there are liars, there are people who are here to deceive, to confuse and confound, and we've got to do everything we can to address that. And remember, these vaccines fully approved by the FDA, right? Fully approved. So this isn't the same moment it was January of 2021. Anyway, 4 things in the checklist. I really put it like this. The first thing is have masks in your home. In this new normal moment, have masks in your home, because you never know when CDC is going to change their guidance and say, oh, your community now has higher levels of COVID spread, you need to wear a mask. You don't want to turn around and pick up an old raggedy cloth mask and think you're doing something. You need to have high quality masks in your home today while they're widely available. You know what people do with water when there's an emergency. Imagine what they're going to do to masks. So buy those now. Okay, the second thing I would say is have tests in your home. I can look around the room I'm sitting in right now. I've got at least 4 or 5 different COVID tests in boxes around here, because pretty much every time I go to CVS, I buy a COVID test. It's just a habit now, because there are 4 people in my family. That means we can get 32 tests per month. And Aetna is tired of me, because every couple of days I'm submitting a new receipt saying, I got more tests today. And they sent me the check. I should show you. Oh, actually, boom, this is the check from Aetna, because I bought some COVID tests. You see, they said he bought $63.15 worth of COVID tests. They sent me this check. I bought these tests last week, had the check in the mailbox on Monday. Every insurance provider is required to do that 8 tests per month per family member. So they're like, Lennox Webb, that 6-year-old boy buys a lot of COVID tests. He sure does. So that's the second thing. Have COVID tests in your home. The third thing is know whether or not you would be the kind of person who needs COVID treatments. So know if you're a person who's at risk for severe COVID, what kind of medical conditions you have that if you were to get COVID would put you at risk for a bad outcome. If you know that, then you'll know long before you have a COVID infection whether you'll need to call your doctor or find a place to get a treatment immediately. You don't want to be trying to figure that out when you're feeling under the weather with the COVID infection. Know that today, whether or not you're the kind of person who would benefit from these treatments. And then fourth, and still critically important, have your up-to-date vaccination status. Vaccinated, boosted, make sure you have that tool, that level of immunity in your system ready to go, protecting you at all times. So between masks, tests, treatments, and vaccines, that's your checklist. As we say, stay ready, you ain't gotta get ready. That's really what I think is the key.
And again, as we've indicated, it's still talk about it. Have the facts. You want to keep answering and asking those critical questions. And for those people that are the doubting Thomases or whatever they are, you really want to understand why they are hesitant, why they do not want to get the vaccine, and try to address those underlying conditions from where they're coming. And yes, being prepared. And that's what this meeting is all about. And I know we're getting close to our time. I want to go around to make sure that everyone has those last comments. And I'll start with you, Candy, if you will provide sort of the take-home message. Well, before I do that, we didn't talk about children. And we know that we just had a new treatment that has been approved for children 5 to 12. We know that they can be tested, they can get a vaccine, and now there's a treatment that is available for them should they get the disease. We still have not gotten data for those under 5. And children will get sick, and we have to be resilient and look very carefully to make sure those symptoms that they are going to get to a treatment facility. But let's start with our final round of comments. Candy, we'll start with you.
Sure. So
what's the take home for our people?
my take home is protect yourself. No one's going to do it for you. You need to protect yourself. And the best way you can do that is to get vaccinated and get boosted and wear masks in public spaces. And I agree with Cameron's other observations around knowing if you're the person who has diabetes, if you're or other family members, knowing that you can quickly reach out to your healthcare provider and get treatment in the event that you get a positive test. And again, making sure that you have tests at home.
Serena.
So I would say, and I kept shaking my head with agreements, but the education and starting young, I feel like it's very important. This is our new normal. My kids they're 5 and 9, and they understand that they are in a pandemic. They know that hand sanitizer is everywhere, that when they get into the car that they need to do their hand sanitizer, that they have well-fitting masks. It took a lot of trial and error, but just starting young and having those talks with our children or these next generations that eventually you're going to be taking care of us, because this COVID's not going away, and this is our new normal. And also just establishing relationships. I think as public health professionals, it's important not just during the pandemic, but to just continuously establish relationships. I know in the military, yes, we establish relationships with other branches, but it's important for us to really get out there with our state and local officials as well, because when this pandemic hit, it hit us all, and it hit us all very hard, and we really had to lean on each other for resources and supplies and personnel. So, but if you have those relationships already established, it's a lot easier to get that help that you need when we do run into a public health emergency like this. Right.
Cameron.
I said it earlier, and I stand by it. I'm tired. I worked in the coronavirus unit in my hospital in the earliest days, and the first thing I noticed was I was watching my brothers and sisters dying. If you look at the age-adjusted death rates from COVID, from 2020, they were much higher in the Black community than the white community. In fact, they were 2.5 times higher. I'm tired because last year, if you look at those same age-adjusted death rates, they're improved. It's decreased 40% for Black Americans, but it's still 1.5 times higher than it is for white Americans. There's nothing biological that creates that difference. I'm tired because I'm tired of seeing family members, cousins, friends sick in the hospital dealing with the impact of this disease. There's the big difference that we have in April or heading into May of 2022 and in April of 2020. The big difference is the tools that we have to keep people safe today. And so I think that so much of our work at this point is to make sure people know what these tools are and make sure they take full advantage of them, because we really have to make sure that there's no reason for our people to be dying the way that they are anymore, not with all the tools that we had. So I'm glad that you guys are here. I'm glad that, we say we're preaching to the choir. This is choir practice, then good. Go out there and spread the gospel, right? But it's an important moment for us to know we've got what we need to stay safe through this pandemic. We just have to apply it. Thanks, everybody.
Thank you. Virginia.
I just want to emphasize that we don't want to forget about our children who are 5 to 11-year-olds. So we know that for those who are unvaccinated in that age group, 5 to 11, they're twice as likely to be hospitalized versus if they weren't vaccinated. And I want to mention that FDA approved yesterday remdesivir, the first treatment for those under the age of 12 if they have COVID. So you can be at least a baby 28 days of age or older and weighing at least 7 pounds now. If you have COVID, you're hospitalized, or you're at risk for rapid progression to severe complications for COVID, we now have a new drug treatment that we've used for teenagers and adults, but now able to be used under the age of 5 and is 28 years of age. So please, we got to work on vaccinating our 5 to 11-year-olds who are eligible for immunizations and know about and keep up to date with these new treatments. And we got to talk to our trusted messengers. You know, our faith-based leaders are critical. A lot of our minority as well as civic organizations that are out there doing community outreach, whether it's to our homeless, you know, and we have a lot of mental health with the depression, anxiety associated with COVID and all the circumstances around that. So we need our wraparound services. People need to know where to go for wraparound services. But we have a lot of healthcare professionals who are out there ready to step up to the plate to help provide resources to our base patients, whether it's the VA hospital, our federally qualified community health centers, our private healthcare professionals who in private practice who are out there available to provide services, and even public health has some community health centers that provide those resources. And if you don't know where they are, or you may not have access to our internet, contact your local health department. Call us. We can tell you where those services are and how to access them.
Thank you all so very much. It is important. We've covered everything except for mental health in detail, but we know that the stress of this disease is wearing. It's wearing on providers, it's wearing on families, it's wearing on communities. But being resilient people, if we communicate with each other, collaborate with each other, be prepared, as you've heard, the things that you need to do, know where the resources are in your community, and have that trusted voice that you can lean upon. We can overcome this. I know some of us are getting prepared to go back to work, and it's going to be a new day. We're not so sure about that, but reach out to each other, have the conversation, because it is important to arm yourself with information, to be prepared, get vaccinated, get boosted, stay as well as possible, and know if you have symptoms, what you need to do and how quickly, because we do have an arsenal of many things to take care of this, much better than it was in November and December of 20 when this first started. Thanks to my panel, and I'm now going to ask Ellis, is there any last words that you would like to have? I thank them all. This has been really important. I think we covered all of the segments, and yes, we have to look at new things that are there. And I see Virginia has raised her hand one last time. Make it quick.
It's
Thank
quick.
you.
Hey, I just want to give a plug to the National Medical Association healthcare professionals. These are Black physicians, the oldest and largest Black physician network in the country. So if you're looking for a physician, contact that association if you need a provider.
Yes, we are there. We're part of that organization, and it's wonderful. The websites, when information is listed, I think we're on social media as well as links that you can get information. And blackdoctors.org, I want to thank them for hosting this with us, the CoVPN network, as well as the Cobb Health Institute. Thank you all and have a good evening. I'm sure there will be other conversations that we will have in the future, so stay tuned. But hopefully this COVID will go away and we can all take a vacation with or without our masks, but I'm keeping my mask close at hand. Thank you.
I would just add one final thing to think about. President Biden, early in this COVID process, announced that people that COVID was going to be covered by long-term disability. And that is speaking to the long haulers in particular. And so, but we also understand that if you're testing at home and you test positive, you must go to and report that positive test and get a positive test you have to document that you had a positive test. Because if you don't do that, if you just test at home and isolate and do your requisite time at home and don't see a doctor, you don't have a record to be able to get disability if at some point in time you need it. So you have to keep that in mind.
That's a great point.
Thank you.
We'll reiterate that going home. But my last statement is this, is very, very simple. 3 words that you need to take with you. Keep home safe. So whatever you need to do, whether it's wearing a mask, whether it's getting vaccinated, whether it's just staying home, if you can work from home, keep home safe, because this is not a disease of the individual. This is a disease of the community, and it shares from one person to another, and everybody has a different medical makeup, and they may not be able to survive this disease like you can. So keep home safe, keep your community safe, keep yourself safe, do what Dr. Webb said, follow those 4 steps, and you will be a wonderful, wonderful citizen to continue to move forward as we face the new normal. Thank you all for joining us. Thank the NMA. Thank the Cobb Institute. Thank you, Dr. Webb, Major Staples, Tandy, Dr. Kane, Dr. Brown. You are all wonderful. Thank you all for joining us, everybody. Thank you for your comments and your questions, and we will see you next time.
Thank you. Have a good night.